changing lives.
And gentlemen, and you are welcome to the consulting room. We always come to the consulting room every Monday at 8 p.m. on the Hope channel, and in the consulting room we learn about all our health conditions and all the things that affect our health as well, so that we can make better choices in regards to our health. Because when we are healthy, we will be useful to our family, will be useful to our churches, society at a large. So today we are going to talk about another very interesting topic. I always say interesting because really all the things we learn about on this show are very interesting. I have with me in studio Mrs. Ivy Dakotete. She's a neonatal nurse specialist at Taifa Polyclinic. You're welcome.
Thank you.
And I have with me on Zoom Dr. Gloria Amponsa Kodia. She's a pediatrician at the Ejiso Government Hospital. She's also part of Healthy Kids Foundation, which is an NGO that promotes kids' health by giving education on child health. They also have a team of therapists and educators for children with developmental delays and disorders. So if you have any concerns, I'm sure you can always reach out to Dr. Gloria Mponsakudia concerning your children's health, and both she and Mrs. Ivy Dakotete would be very willing to help you. You're both warmly welcome to the program today.
Thank you.
Thank you.
Okay, so today we are talking. You're welcome. Today we are talking about neonatal jaundice. We've heard a lot of things about neonatal jaundice. Some people even don't know that when their babies turn yellow, it's an issue. So stay tuned and remember that you're going to learn a lot. Today, as always, we have cocoa milk being the sponsor of this program. So as I always say, it's a natural milk. It's dairy free. It's good for everybody, so we can all get it from all the shops around us, and we'll be healthy. Yes. So diving straight to the program today. When we talk about jaundice, what is jaundice, Mrs. Dako?
Well, so practically jaundice itself is a symptom or a sign of a condition.
Okay.
But then we have neonatal jaundice. And I believe that is what we are talking about today.
Yes, neonatal jaundice.
So basically, neonatal jaundice is the yellow discoloration of your child. So
here we don't understand English, the big words. So just break it down for us. Discoloration.
Okay.
Yeah.
So basically, your child's or your baby's palms will turn yellow. The eye will turn yellow. Sometimes you see it on the skin, on the nose, on the chin, on the face, on the belly, on the back. So it's like you see your baby becomes yellow. But it's a process. So sometimes you see only the eyes that turn yellow. So a lot of times mothers will bring their child or their baby when the eyes have turned yellow.
Okay.
A lot of times that is the most thing. But you have it, the face, the coming down, so it's cephalocaudal from head to down. So you see the eyes, sometimes the tongue, the mucous membranes, the palm, the soles of the feet. So basically, when your child becomes yellow, you see any yellow in the eye, in the face, in the skin, then you can say your child is jaundiced.
Okay. So are there any babies who are particularly at risk of becoming jaundiced? Dr. Amponsakudia.
Yes, thank you very much, and good evening to your viewers. Yes, there are some babies who are prone or more at risk of getting jaundice, and one of them is babies who are born prematurely or who are born before the 9 months or 37 weeks. So premature babies are prone to getting jaundice. And then babies who are also not being breastfed well. So for whatever reason, if the mother is not lactating well, the breast milk is not flowing as it should, or the baby is not sucking well. And you know, there are times that babies are born with clefts in the lip or the palate or other conditions.
They are born with a space on their lips and their mouth.
Yes, yes. So it makes it difficult for them to attach to the breast and suck well. So when there is so babies who have challenges feeding, breastfeeding, or mothers who have problems with production of milk, so such babies would have a higher risk of getting jaundice. And then also we have mothers who have certain blood groups or blood types. So if a mother has blood group O, the baby the mother gives birth to, if the baby has another blood group other than O, then that baby is at risk of getting jaundice. So the risk is higher. Exactly.
That's
so blood group O. Yes. And then also for mothers who have blood group that has negative attached to it. So you can have a mother with blood group O negative, B negative, A negative, AB negative. So if you're a mother and then you have something negative as your blood group, if the baby's blood group is something positive, so let's say your husband is B positive and the baby takes the B positive, so that baby is at risk of jaundice, at an increased risk of getting jaundice. So mothers with blood group O or something negative, such babies are at risk. And then we also have a condition we call G6PD deficiency. It's a big word, about 4 words put together. And what it basically means is that these babies do not have something in their blood that is supposed to protect the red blood cells. And so the slightest exposure to waste, let me put it that way, so toxins or waste or infection, then they are also at an increased risk of getting jaundice because their red blood cells will start breaking down. So these are some of the babies who are at risk of getting jaundice. Sometimes we also have some babies who are born and the birth process was a bit difficult. So they have fractures somewhere. So sometimes commonly it's on the head. You see a little bump, a little swelling on the head, and it's just a collection of blood. So those babies, are also at risk of getting jaundice. So these are some of the common ones, risk factors for jaundice.
So with what you are saying, it means a lot of babies are at risk of getting jaundice because it's from very healthy babies who might not be breastfeeding well to babies that had a very difficult birth. That's what you are saying. Okay, all right. So I hope new mothers would be on the lookout for this so that they can quickly pick up the signs of the yellowing in their babies. How do you mentioned that you see the yellow in the, Mrs. Darko, you mentioned that you see the yellow in the eyes, is that the only way you can actually recognize jaundice?
So a lot of times, the jaundice usually will be seen, the physiological jaundice will be seen like 2 to 3 days after birth. So a lot of times, when the mother has a normal delivery and has been discharged home, usually they are the ones who will bring their babies back, reporting with the sign of jaundice, because we give them the discharge teaching, as part of the discharge teaching, danger signs that they are supposed to bring their babies back. So usually they will come and say that my baby's eye turned yellow. But then when they bring the child to the hospital, you can't just say that you are using the physical appearance of the child to only diagnose. So there are other blood work that you have to do. So as she mentioned, she said when somebody has G6PD, so as part of the routine labs that you do a full blood count. If sometimes some of them might be hemolyzing. So when you do a full blood count, at least, like, so as she said like from birth injuries or birth trauma. So if a child has caput or kefal as a result of forceps delivery or poor maternal effort and they had to. So the child has collected blood in some parts of the scalp. And then that collected old blood will be breaking down. So as the red blood cells are breaking down, the byproduct bilirubin will be seen. So the levels will increase. So when the child comes in, mother says that the eye is yellow. You do your assessment. So sometimes you do your physical assessment with your Kramer's index, and then you go on to do other things. So you do your full blood count, you do your GCSPD, especially for the male children who might inherit the gene from their fathers. So we do a GCSPD, we do a Combs test for the resource and the ABO incompatibilities, and then we do other things too. So sometimes when they come, at my facility level, we have a billigan, but the billigan only gives you a fair idea of what is happening. You need to take the sample. What is
a billigan, if you can explain to us a bit?
So the billigan is like the gun thermometer that we all know since connecting.
The new ones that we have around.
So you press it on the baby's forehead and then on the sternum. It gives you a fair idea of the level of bilirubin the baby might have. But that, because it's not a blood work, it's not really conk.
It's not
so you take your samples for your LFTs and then your serum bilirubin levels to tell you the actual levels that you have. And sometimes you might test, and some of the children might have conjugated or unconjugated hyperbilirubinemia. So it depends on what you pick on the blood and that. So at the end of the day, you should be able to tell if this is pathological. But usually when it is pathological, you will see it in the first 24 hours of life. So immediately the child is born, you will see it.
All right. So Dr. Amponsa Kodia, what are some of the it looks like neonatal jaundice is a big issue. What are some of the reasons why, especially you, keep talking about neonatal jaundice?
Yes, and just last month, the Pediatric Society of Ghana had the Newborn Jaundice Awareness Month. Yes, we make a lot of noise about it because jaundice, especially in the first week of life, can cause a lot of harm to the baby. And what happens is that the substance in the blood that is making the baby's eyes yellow and the skin yellow, which my colleague talked about, called the bilirubin, can actually cross and get to the brain. It can cross the covering of the brain and get to the brain. And then it will stain the brain. It will be deposited in some parts of the brain. And when that happens, and it's permanent. When that happens, the baby's development will not go so well. So there'll be when the baby is supposed to sit or crawl or walk or talk, that can be delayed just because that substance called bilirubin, that yellow thing, got to the brain and stained some parts of the brain. Because of that, that baby's development will be, and it's permanent. It's a permanent brain sort of damage. Yes, you can't reverse it when it happens, and that's why we make a lot of noise about newborn jaundice, because we don't want it to get to that stage. And the good thing is that if you identify it early, and you get to the hospital and the right thing is done for your baby, you won't even get the bilirubin, that substance, becoming so high in the blood to the extent that it now has to go into the brain and cause that damage. So that's why we make so much noise about newborn jaundice, especially in the first week of life.
So we don't want our children to be at the bottom of the race. They are already starting with some form of minus. You are writing an exam and the teacher comes to write -20 on it. I think, that's a good thing. So I hope the awareness is catching up, or it's not. Is awareness catching up? Are you seeing any difference in the number of cases you used to see in the past, or it's still the same?
So I think now, because we are making a lot of noise about it, a lot of the mothers are bringing their babies. Immediately they identify that they are yellow. As compared to before. Before, people had the misconception that when they put their babies in broad daylight or early morning sunlight and they are yellow, the yellow will just go away. But since So our new maternal health record, we have it at the back, the danger signs, identification of danger, and the jaundice is part of it.
The red book that they give to
now
you.
Now it's a green book.
Oh, now it's green. Okay, my facility is still red.
Oh, okay, so we have both the maternal and then the newborn record in the same book.
Okay.
So it's easier for us to follow what's happening.
Yeah.
So when they are going home, we educate them on the danger signs when they are supposed to bring their children to the facility. Initially, they had the impression that, oh, when my child is yellow, because the nurse said I should come back on Thursday, they'll wait and come back on Thursday.
Okay.
But we kept telling them that you don't have to wait. The moment you see your child is yellow, bring them.
Yeah.
So we have a lot of people coming in. And a lot of times they come in and the levels are very high. They are quite high, especially for some of the mothers who have gone through cesarean section.
Okay.
It's a problem for them to initiate lactation in the first few
breastfeeding.
Yes, to initiate the breastfeeding, because some of them might complain of pain when they put the babies to breast. So a lot of times we have about 80% of babies who were born through cesarean section coming in with
that's a large figure.
And a lot of times they will be on the ward for like 3 days before you discharge. And by a third day, sometimes you pick it up on the ward before they are even discharged home. So I think that now, because we are making a lot of noise about it, people are really bringing their babies in early.
Okay. So what are some of the treatment options, Dr. Amhosa Kodia?
Yes. So we have one called phototherapy.
Yeah.
And when we check the level of jaundice, let me just put it that way, the levels, and it's very, very high, then we put them, or it gets to a threshold such that we have to intervene. We can't put them under this special lights. We call it phototherapy, or phototherapy machine. So most of the time it's blue. So we put the babies under this light, and it's supposed to break down that substance that makes them yellow to another form that can be easily cleared from the body.
Okay, so the bilirubin is difficult to clear from the body. That's what you're saying?
Yes, because the babies, the liver is what tries to get rid of or change the bilirubin into a form that can be cleared from the body through the urine or through the stools. But for babies, because the liver is still immature, so that the function is not like that of an adult, it takes a while before it can start functioning optimally. So the function the function is down when they are born, and doesn't clear it as fast as an older child would clear their bilirubin from the body. So you have to support by putting them under this light, which will help to also change the bilirubin into a form that can be easily cleared from the body through the urine. So that's one way, the photo light. And then when it's also at a certain level, sometimes it's so high that you need to quickly bring it down, bring the levels down before it gets to the brain. So that one, we do what we call exchange blood transfusion. Basically, what we do is take out the blood of the baby that has the high levels of bilirubin, and then put in blood that doesn't have this bilirubin, or at least in that high levels. So we get fresh blood from somebody, from maybe a donor who matches, and then we give this blood to the baby, and then take the baby's blood from the baby. It's quite complex.
Yes, it sounds engaging.
I know, it's almost impossible, right?
Yeah.
But we do it. So as we push in the blood that doesn't have this high levels of bilirubin, we take out the baby's blood that has high levels of bilirubin. So at the end of the procedure, you realize that the bilirubin levels have dropped drastically, very, very low, and it won't be at a level that can cause damage to the brain. So these are the modalities. We can put them under the light, which is what we commonly do when it's not so high, and when it's very high and poses a risk to causing brain damage, then we have to drastically bring it down by taking the baby's blood out that has the high levels of bilirubin and then putting in blood that doesn't have bilirubin at that high levels.
Okay, all right, thank you very much. So, so far we've learned about what neonatal jaundice is. We are talking about the babies that are at risk. Babies that are born before the 9 months or 37 weeks, babies that have different blood groups from their mothers, and babies that are born to O type blood, what's the word? O blood mothers, yes. And babies that had a difficult birth, probably had netikwa swakakra when they gave birth to the baby. And well, we are learning a lot. So we are going to go on a very short break. We'll come back and we'll learn about some of the misconceptions people have about neonatal jaundice, so that you can clear all these misconceptions for us, because I'm sure it will be of great help to especially new mothers. So please do well to join us when we come back from the break.
Dairy-free coconut milk. Cocoa dairy-free coconut milk is a fully plant-based milk, non-curdling in tea or coffee, and it's a lovely treat with any breakfast beverage or meal. It contains calcium and vitamin D2 for strong teeth and bones, and vitamin B12 to help boost your blood for vitality. Cocoa is 100% vegetarian and is approved by the Vegetarian Society of UK. It's also lactose and dairy-free, which is good even for people with lactose intolerance. Cocoa, get one today. Cocoa dairy-free coconut milk. Nature's health at your doorstep. For bulk purchases, contact 027-444-0180. This advertisement has been vetted and approved by the FDA. Cocoa dairy-free coconut milk.
We want to defy our family's decision and get married or elope. I need advice. What should I do?
Please, what should I do?
How do I tell her I cheated on her months ago? I need help. What should I do?
Okay, so for me, the moment I read the story, the first thing that came to mind was, wow, knowledge is indeed power. Sometimes we go through situations because we have no knowledge of how to go about them.
If you come from a home like that, you are likely to accept anything the outsider would, direct at.
The fact that we had an interesting ceremony where a priest prayed and all of that doesn't mean that magically you have turned into something else.
If he finds his way to God, a Bible-believing church, and he goes and he wants to change, nothing is impossible. Is he giving his
properties to charity and stuff?
Oh no, why? Okay, I think this is another discussion that we will not end today, so we'll not even go into it.
Real talk, showing this and every Wednesday at 8 p.m.
To the consulting room. Today we are talking about neonatal jaundice. If you missed the first part, don't worry, there's still a lot you are going to learn from this time till we get to the end of the show. Already we've learned about what neonatal jaundice is. If you see your baby turning yellow, it's not because your baby is becoming beautiful, no. There's a lot of things going on in your baby's body that needs to be seen by either a nurse or a doctor. And if you don't get your baby to the hospital in time, you could have a baby with brain damage right from the start of life. So if you have any questions or any contributions, you can send them to us on WhatsApp or via text on 055-968-0066. 055-968-0066. So but whilst we were on break, we were talking about some of the things some people do to their babies when they have jaundice. What I personally know of is people putting all sorts of concoctions, some as bad as cow dung on their babies when they have the yellowing of their skin. Some people, they give them some scars on their body and put some paste, herbal. Are they good? And if they are not good, what are the good ways that they can go about it? And tell us about the bad ways too that people deal with this condition, Mrs.
Okay, so I think I encountered a patient, I think about 8 months ago.
Okay,
So,
that's recent.
Yeah, that's recent. The baby was jaundiced, and she was insisting. So she went through cesarean section, and she was insisting she wanted to go home. So that was like the third child.
Okay.
We kept telling her that the baby was jaundiced, so we had to put the baby under the blue light. But she kept insisting. So what she said was that, oh, her first 2 children had jaundice, and they prepared some kind of soup with some herbs.
Soup?
Yes, soup with some herbs in it, and she drank it, and after she breastfed the babies, the jaundice cleared.
Okay.
But then, come to think of it, I was like, what is the relationship between what she had taken and then how baby's yellow went away? So people have that misconception that they have to take some herbal medications and then they will breastfeed. Some people take herbs and they put in the water and bath the baby's bath water.
Some people actually give the bath water to the
babies to drink because they have the impression that when you bath them, you just put some of the water in the mouth and then they won't become yellow. And then the other one that we all know is that they all put the babies under sunlight. They think that when you put your baby in sunlight, then the jaundice will go away. And some people also think that babies who are given formula feeds turn yellow as compared to babies who are breastfed. But it's the other way around. Babies who are breastfed rather turn yellow earlier than those who are giving the formula feeds.
Recording stopped.
Because babies who take the breast milk usually will take lesser amounts because it will take time for the mother to establish the whole breastfeeding phenomenon. So the babies get lesser milk.
Especially for new mothers.
Yes. So they get lesser milk. The babies are slightly dehydrated and they turn yellow. But for those who are on the formula feeds, they will be given feeds.
Already made.
Yes. So if a baby is on formula feeds and the baby is turning yellow, probably the baby might have problems breaking down the galactose in the feeds, the galactose part of the milk, or baby is having a very long transit time in the gut. So baby is not really able to pass feces, and that the enterohepatic circulation is taking place. So the jaundice, the yellow is going back into the bloodstream. So basically, these are some of the things that people think. People think that, and some also think that every baby is supposed to turn yellow.
Oh.
Yeah, some people think that every baby is supposed to turn yellow, and when babies turn yellow, it is normal. But then, it is not normal for your baby to turn yellow unless we have assessed, we have done a thorough examination, and we have said that, okay, the levels are not toxic, so you can take your baby home and then continue.
But how many mothers do you actually tell to take their yellow babies home?
So some health professionals at a point will tell them that, oh, this yellow is not that much, so take your baby home. We've had a few times with the mothers telling us that, oh, I brought the baby and I was asked to send baby home because she said it was not too yellow. But then you saying it is not too yellow doesn't guarantee that the levels in there are not too high or they are not toxic. So before you can rule it out, at least have some test run or just be sure that you have done the right thing to rule out that baby is okay and it is fit to go home. Because of course, even if you do phototherapy, the yellow will not clear off immediately. It will take some time. And some can last up to 14 days, especially those who are suffering from the breast milk jaundice. So you can have jaundice lasting up to 14 days and baby will still be yellow. Just that the levels will not be toxic.
Okay, all right. So you don't have to go and put your baby in the sun because your baby has turned yellow. So Dr. Amfonsa Kodia, some babies also get, I didn't really hear you mention babies who get those infections around their cord and all of this. Are they also at a risk of getting jaundice, or they are really not affected? Someone was asking about that. That's why I drew my attention to it. Okay, and
sorry.
No.
Yes. So
Please, you are
Can I go
listening.
ahead?
Yeah. Sorry about that.
Yes. So before I answer the question on the cord infection, let me just add a few to the misconceptions.
Okay.
And sometimes mothers also give glucose to the babies who have jaundice. They think that as they give the glucose drinks to the babies, it will clear the jaundice, and we don't do that. I mean, it's not recommended at all. Now we are actually advocating exclusive breastfeeding for the first 6 months.
Yes.
And the benefits of breast milk, they are just enormous. So we don't want. And if you compare those who were exclusively breastfed to those who had mixed feeding or formula feeding, they do better in academics. They have less allergies. They have less problems with constipation and diarrhea and all that. So breast milk is good. And even though sometimes at the beginning the mother may not be producing enough breast milk, we say just continue to put the baby to breast. As the baby sucks and you eat well, you drink a lot of fluids, you rest, you will start producing the breast milk. So yes, sometimes those who are breastfed may develop the jaundice because they are not the mother is not producing enough breast milk at the beginning. We still advocate for exclusive breastfeeding, and sometimes we also have those being breastfed also developing jaundice, one we call breast milk jaundice. So that one takes a bit of time to clear. Sometimes it starts after 5 days or so, and it takes a bit of time to clear. But we are not worried about that. I mean, send the child to the hospital, let them examine the child. If she's fine, you continue to breastfeed. With time, it will clear. If it's so high that they have to put the baby under lights, they will do that. But it's breast milk. Okay, that's one thing I want to drive home. And we are not doing glucose drinks. We are not, as my colleague said, we are not putting them under the early morning sun. And we are not putting camphor balls in our children's or our babies' clothes. Camphor is very harmful. Yes, people still do that. And if your baby has G6PD, what I talked about earlier, and you put
the deficiency you spoke about.
Yes, you put camphor balls in their clothes, then the red blood cells will break down and the baby will get very jaundiced. And even for those who don't have G6PD, camphor balls, they're actually toxic to everybody. It can be absorbed through the skin, and they can cause diarrhea and other, even kidney, they can affect the kidney. So camphor balls, we don't want them near any baby, whether they have G6PD or not. And the question about the cord infection, very, very important. And it's not just cord infection. Any infection at all in the baby can put the baby at risk of jaundice, because infection can also cause the breakdown of the red blood cells. And this bilirubin comes about as a result of breakdown of the red blood cells. So the red blood cells will break down, and then you have bilirubin being formed. And if the liver doesn't clear it quickly, then it accumulates, it rises to high levels, and then it starts staining the eyes and then the skin. So once you have any condition which causes the red blood cells to break down quickly, such as infection, the baby can be at increased risk of jaundice. And so cord infection, general infection, sometimes they may even have infection of the covering of the brain. So we call it meningitis. And those babies are even at a higher risk of getting the bilirubin crossing over to the brain and even causing damage. So infection is very, very important. And if you have a mother who started losing liquor, or the fluid that the baby sleeps in, if the mother started losing that fluid before labor sets in, so before the contraction started, the mother started losing liquor. And sometimes it takes days, maybe 12 hours, 24 hours, 2 days before the mother delivers. During that time that the mother was losing liquor, germs can travel to the baby.
Okay.
And the baby will get infection even from the time the baby is born. So they are also at risk of jaundice. So if you are a mother, you have fever, you are losing the liquor, you are losing the fluid that the baby baths in, don't sit there. Go to the hospital and let them check you out. Because if they don't treat you, your baby can get the infection and also develop jaundice. And it may be a severe form of it.
Okay, so I think you've actually added a bit of the prevention. That was the next question I was going to ask, and that's actually a question somebody just sent to us. So the person is asking, can jaundice go on its own? And later we'll talk about the long-term side effects of jaundice on the child, but can jaundice go on its own? I think she wants to avoid coming to the hospital.
Yes, but then me giving this answer doesn't warrant that if your child is jaundiced, you have to keep your child in the house.
With all that you've spoken about and the brain damage ultimately, why would you stay home if you see that?
So basically, the jaundice is like a curve. So we have the curve, it rises and then it drops. So 2nd day, 3rd day, child is jaundiced, levels will be rising 5th day, 6th day, 7th day, then the curve will be dropping. So for physiological kind of jaundice that the levels are not toxic, you have it reducing by itself. But then just because we want to be sure that it's either physiological, is whatever kind of jaundice, just bring your child to the facility. After we have assessed and the levels are not toxic, we can decide to let you go home for jaundice to clear by itself. And sometimes though, if jaundice is from dehydration, once you correct dehydration, because automatically when the bilirubin is broken down, it becomes water soluble. So it will be excreted through, like the child will pass it through the urine and then the feces. So if you are not feeding your child, even if the yellow is broken down, it can't come out. So once you correct hydration, you hydrate the baby, you are feeding baby is passing stools, baby is passing urine. It's expected that if it is within the normal levels or the non-toxic levels, it will go on its own, other than putting in photo or what. Because my colleague said earlier on that if the levels are not toxic and they are within clinical values, you can just encourage mother to breastfeed. You can encourage mother to keep baby hydrated by breastfeeding, and then baby will just be fine.
Okay, all right, that's good to know. Dr. Amponsa-Kodia, so what are some of the complications or the side effects, the very practical side effects you've seen with babies that got jaundice?
There's a condition that we call cerebral palsy, very big term.
Yeah.
But basically, these are children who have difficulty with movement and then posture. So sometimes, I mean, for babies, 4 months, 3 to 4 months, they should have control. The neck should be able to support the head.
Yes.
And then around 6, 7 months, they are sitting on their own. And then they start crawling around 9 months.
Yeah.
By 1 year, 2 months, they are walking.
Yeah.
Now, babies who develop jaundice, a severe form, and it gets to the brain, those babies would have difficulty with their movements. So at 6, 7 months, you realize that these babies cannot sit on their own. They may still be lying down or would have to be propped up. And then it takes a long time for them to even sit and then start crawling. Some do not even walk at all. So cerebral palsy it's a huge thing, and one of the causes is severe jaundice. Jaundice that has the bilirubin so high that it goes to the brain. That is one of the complications of jaundice. And it can also cause intellectual impairment. So the baby or the child's IQ or intelligent quotient. So the baby will not be doing so well in school. They may also develop seizures or epilepsy.
Okay.
Or convulsions.
Those are quite serious side effects.
Yes. They are very serious side effects, and sometimes even they have issues with coordination. So even their hands, what they are supposed to do with their hands, feeding themselves and then writing, and all those things they are supposed to do with their hands, they're having difficulty doing them, all because of the jaundice or the bilirubin go high and then gets into their brain, and they can die. There have been babies who have died from severe jaundice. Their mothers didn't bring them early. They came to the hospital already having difficulty breathing, and unfortunately they passed on. So jaundice is not something that we should play with. And there's another kind of jaundice which may not warrant that we put them under line. There's one that we call prolonged jaundice. So those ones, there may be issues or problems with how the liver, after changing the form of the bilirubin, getting it into the intestine so that the baby passes it out with the stool. So it doesn't get to the intestine, and those are structures in the liver. We call them biliary system or tract. So if there's an issue there, they also get jaundice. That kind of jaundice may not be the type that will get to the brain and cause brain damage, but it can cause liver damage. It can destroy the liver with time, and the baby may eventually die if it doesn't get a liver transplant. But that one also, if it's detected early, there can be some interventions. Surgery can be done for such babies. And the one thing that characterizes that kind of jaundice is that their stools are usually pale, very almost white. You see, the bilirubin or that thing substance is when it gets into the intestines is what gives the stool its yellow color. So for babies who for whatever reason are not able to get the bilirubin into the intestines, the yellow color in the stool will not be there. So the stools appear very like cream or almost white. So that kind of jaundice is also something that needs urgent attention. You need to also report to the hospital if your baby's stool is not yellow, it's a little whitish. Send the baby to the hospital, let them enter. That baby may not be put under photo light, but will need a surgeon to assess and to prevent liver damage.
All right. Thank you. So, Mrs. Dako, there's a question about a baby who is 3 months, but then the cord sometimes brings out some discharge. This person wants to know what to do.
Please come again.
My baby is about 3 months now, but the cord sometimes brings out discharge. Please, what should I do?
So a 3-month-old baby with a cord still discharged, and I think she has to visit the nearest facility so that the cord can be assessed, because the cord, even with the chlorhexidine that we are saying that the cord can go up to 14 days before it falls off. By 14 days at least, they should fall.
3 months.
So for 3 months, and the child is having discharge from I think this one, she has to visit the nearest facility so the child can be assessed.
All right. So
and it is Mrs. Tete.
Oh, Mrs. Tete, sorry. So, Dr. Amponsakodia, this is a long question for you. It says, please, good evening. I am Ikia. My baby had jaundice from birth. She went through phototherapy and went to see the specialist. LFT and INR was done. It was conjugated. Later, she was given vitamin D3 and is still on it. She is 4 months, 3 weeks now and is clearing. The total bilirubin is now 39 and conjugate is 14. I have been worried from day one and I'm still worried. Will my baby recover completely and live a healthy life? She is fine and sucks well, but I want you to advise me. We go to Confanoche every 2 weeks to see the special doctors. They are doing so well, but I need more advice. Thank you. Dr.
All right. Worried mother, I can understand. Yes, so
she's called Ikia. The mother is called Ikia.
Yeah,
Yes.
yeah, my friend. Yes. So it's good that the baby is getting help at the right place. So Confanochi has specialists, and there are some that have actually specialized just for the liver. And then the intestine, yes. So we call them gastroenterologists. So when you have that kind of jaundice, they manage the baby sometimes together with the surgeon. So it actually depends on the type of jaundice. There are times that there are some enzymes, some things in the liver that help the bilirubin to be changed into a form that can be cleared from the body. So if these substances or enzymes are lacking, sometimes it's there, but it's in very small quantities. And so they also get jaundice. So it's cool that he's getting the specialist. They monitor the child, they check the liver function, as she mentioned, they check the other things that the liver does. So she mentioned INR,
yes.
Because the liver also helps clotting. If something cuts, you get a cut, it produces certain things that cause the bleeding to stop. And so when the liver has an issue, then those clotting factors go down. So we also check all that, and it's good that he's getting that check. So I think this baby is in good hands. They are on the right track. Once she's being monitored, and then the levels are clearing, then that is great. So it means whatever the issue was, it's being managed, or it's being kept under control. And it's important that we monitor the development. So if the child is, what did she say, 4 months?
Yes, 4 months, 3 weeks. So almost 5.
Okay, so 4 months, the head can stand, or let me say that the neck can support the head. So what we call head control. If that is there, that's good. If the child is smiling back at you when you smile at her, that is also development in the right path. And if the stool color now, maybe before it was pale or was a different color, now it's yellow, the jaundice is clearing and all that, it means the baby is on the right path. And I will say that once she's being seen, or the baby is being seen by a specialist, she shouldn't be too worried, and unless they tell her that something has gone wrong. If the baby is developing well, the stools are okay, the liver tests, when they do, it's improving, the jaundice is going down, and she's also getting the medication that she needs, I think she should not be too worried about that. But she should still keep for her appointments.
Okay, all right. Thank you very much. Our very last question and your final words. So the last question is, can jaundice cause autism? This is a question from one of our viewers.
Well, autism is a broad spectrum disorder, and sometimes it's difficult for you to pinpoint what might cause it. Yeah. So we might one day say that maybe it's a predisposing factor to autism. But then, yes, jaundice can make you have learning disabilities. You can go deaf. Some of them go deaf. They go totally deaf. Some of them go partial deafness. So I can't really
say it is
find a place to put it's a cause of autism, because autism as at now, we've not really been able to touch on it as what causes autism. But then some people might have said that their children have broad spectrum. So some of them who have cerebral palsy end up with, some have autism and they have cerebral palsy like together. Yeah. But we can't really find a relationship between having connectors and then autism. We can relate it to cerebral palsy, but I can't really relate it to autism. I'm yet to see a literature that touches on it.
I'm sure as medicine develops, you would find. So your last words, Mrs. Tete.
So my last words.
Yes.
Neonatal jaundice is not something we should just brush off.
Okay.
It will take you by surprise. I have lost a patient because of neonatal jaundice on 2 occasions. I think the mothers kept the babies home for so long before they brought to the hospital. So come to the hospital. Let the health professionals assess your baby. If they rule it out that the levels are within the clinical levels that are not toxic, then you can go home peacefully. Or if your child needs to undergo phototherapy, then we do the needful. Or if any other management tool has to take place, then we do it. And then, so we have something we call congenital infections. So we have the torches, the toxoplasmosis, and all those things.
Okay.
If the mother has measles during pregnancy, rubella, if the mother has syphilis, if the mother has any of those torches during the time of pregnancy, the child might come out with a congenital infection, which will predispose her to the child to jaundice, as Dr. Riley said.
Yeah.
So if you are a mother and you have malaria, you have anything during your time of pregnancy, you should just visit the facility. And those who do herbal medications. So herbal medications have also been part of the predisposing factors to babies who have jaundice after birth. So we are saying that if you are pregnant, try as much as possible not to take any unprescribed medications, any drug that so if sulfur medication, so you don't even know the GCPD status of the baby that is coming out. So if you take any sulfur medication during pregnancy without it being prescribed, then you know that your child might end up being jaundice if she comes out and she is GCPD deficient or something. So we are saying that if you are pregnant, just visit the facility when you are not well, get the right treatment, get the right prescriptions, and then you don't take herbal medications, you don't take any herbal preparations. If your child is yellow, just bring your child to the hospital.
Okay.
Yes.
Thank you.
And to my colleague nurses and midwives, sometimes when babies, they deliver babies in the theater and mother is not breastfeeding, some of them tend to give 10% dextrose or something orally. Please, we should try as much as possible not to do that. If you feel that your baby is going into hypoglycemia, you should feed. The best option is for you to feed. So if mother is not getting breast milk, fine, you can do formula feeds until breast milk starts coming. At least it's the best way to go. But we don't give any other thing like glucose, any other thing like 10% dextrose or 50% dextrose orally to our babies. So please, let's all pay attention to that. So on that, I think,
Dr. Amponsakodia, your last question and your last word. So someone wants to know what they can do to help with easy flow of breast milk, since we are talking so much about breastfeeding and its benefits in jaundice, neonatal jaundice.
Yes. So any form of stress, can reduce the production of breast milk. So try as much as possible to relax. Get help if you need so that you can rest. And as the baby attaches to the breast and sucks on the breast, then you get more breast milk production going on. So put the baby to breast. Even if there's nothing coming out, put the baby to breast. Let the baby suck on the dry breast. With time, there will be some breast milk production. And you also try and relax. Get some rest, take a lot of fluids, water, drinks, liquid soup, and all those things. And they can also help with breast milk production. So eliminate stress as much as possible. Eat well, relax, put the baby to breast, and the breast milk will start flowing. Just to add, so my last words, I will say that let's look out for jaundice in our babies. The figures stand as such. 8 out of every 10 babies born prematurely will develop jaundice or at risk of jaundice. 8 out of 10. And then even for those that are born at 9 months, about 6 of them out of 10 babies will develop jaundice. So it's quite common. And so we should look out for that in our babies. You know how when babies are born, we keep them in the room. We don't want any bad eye to see them and give them diseases. So we keep them in the room. We don't even
put on the lights.
Bring them into the windows. You don't put on the light. But you have to look out for that in your baby. So morning and say late afternoon. So around 9 a.m. when there's bright light. If you don't want to send the baby out, bring the baby close to the window
Okay.
And some of the light rays together, you can see, just look at the skin. You can press the skin and see when the baby is jaundiced. If you press the skin, you can press the forehead, you can press on the nose, you remove your hand, that place will look yellow. Or sometimes when they open their eyes, you can actually see the yellow in their eyes. So let's look out for jaundice in our babies. Twice a day, at least. Early morning around 9, and then maybe 4 p.m. thereabouts. Okay. You also let the baby close the windows and then look out for jaundice in the babies. And when we say that we have to admit the babies and treat them, let's allow the nurses and doctors to do their job. Sometimes the mothers refuse admission because they want to go home and wear their white sheets and their white slippers and all that. But we want a healthy baby. Okay. So let's do the right thing for the baby and breastfeed. Okay. Once you breastfeed, a lot of the times you'll be able to reduce the incidence of jaundice. So let's put the baby to breast early. Even if you had CS, try and put the baby to. Now we are advising, we are telling health workers, even in theater, right? Sometimes on the theater bed, you still attach the babies. When they get to the recovery, we ask the nurses to help let the babies attach to the breast so that the breast milk will start flowing. So let's breastfeed. Okay. And do away with the myths of jaundice, and our babies will do well.
All right.
Thank you.
Okay. Thank you very much, Dr. Amponsah-Kodie and Mrs. Tete, for the education you've given us today on neonatal jaundice. We are very grateful. So I'm sure that as you are learning every week, next week, Monday at 8 p.m., you join us again in the consulting room. Enjoy the rest of your weekend and have a good evening.